I want to welcome all of you here that are able to be with us, either in this room or out in the lobby and or online. We are glad that you've tuned in to us. We hope that you have. This morning we are really gathered together to be informative and hopefully provide you with some other details that to answer questions that you may have with where we are with COVID-19, the pandemic, and the city of Dothan and Houston County and the Wiregrass area in general. I'm going to just give you a list of who's going to speak, and then each one of us will come up one at a time to speak. The next person will, when one finishes, the next person will pull away, and then the next one can come up, and then after we're done, we'll open it up for questions, either as a group or individually if the media would like to do either one. So wanted to make sure we got that out of the way. Of course, I'm Mark Saliba, Mayor of the City of Dothan. We have Southeast Health, George Narby. Dr. Narby will be here as the Chief Medical Officer. He will be speaking on behalf of Southeast Health. Flowers Hospital, we have CEO Jeff Brannon will be here, or is here, to speak. Of course, Corey Kirkland is our Public Health Administrator for the 10 counties for ADPH. Thank you for being here and providing an update as well. And then Chairman Culver, Houston County Commission, and I will round it off at the end. So first want to invite up Dr. Narby from Southeast Health. Dr. Narby?
Good morning, everyone. I want to thank everyone for the opportunity and the mayor for the opportunity to speak here this morning. First of all, I want to present a little good news, and then I'll walk through our mask requirements and visitation policies, and then some other things, and then touching on vaccinations. As of yesterday, Southeast Health had 8 COVID inpatients, which is actually a low, and we haven't had that low volume for many months. And our volume of COVID inpatients has remained low now for several weeks. And as y'all will recall, that's from a peak of about 117 patients early in January, around the 8th. So that's good news, and we're very excited about that. The last thing any of us want to see is a 4th surge. So what I talk about next is really going to be sort of aimed at that concern. First of all, regarding masks, Southeast Health, all Southeast Health entities will continue to require masks to be worn in the foreseeable future. And the reason for that is to protect both our patients and our staff from getting COVID. We believe that masks contribute to a safer environment, and we will keep that requirement on our facilities after the mask mandate and again going forward. Finally, Alabama College of Osteopathic Medicine will also require masks, and in deference and after careful consideration, ACOM will conduct a virtual graduation ceremony rather than a live ceremony. This is because of all of the travel for friends and family that may occur. We're trying to eliminate that risk, and also, again, for the safety and comfort of our students and their families. We're very proud of our ACOM students and the things that they've been able to do through this last year. Next, visitation at Southeast Health. A bit of a change. Non-COVID inpatients may have up to 2 visitors or support persons each day, and one of those persons may remain with that non-COVID inpatient at all times. A second visitor can see the patient between the hours of 10 a.m. and 6 p.m. All visitors, as in the past, must check in at entrance 2, which is located on the upper level of the east parking deck. Regarding outpatient visits at the doctor's building, due to social distancing constraints and the limited space for waiting areas, patients coming to see doctors in the outpatient building may have 1 guest of any age. The only exception to that would be patients with newborn babies seeing the obstetrician for a post-delivery visit. Vaccinations. To date, Southeast Health has administered over 33,000 vaccines, and we continue to do that every day, Monday through Friday, and following the state guidelines, offer that vaccine to patients age 16 and over. Right now, we have appointments available, and you could go and register for an appointment and get a vaccine this morning at Southeast Health. We continue to encourage people to get vaccines and have noticed that interest in new first shots seems to be a bit declining. We have lots of appointments available. And at this point, I would just say there's only two ways out of this pandemic. We can all get the virus and experience the disease, or we can all get vaccinated. We need between 70 and 90% of the population to be immune to COVID, and we're not there yet. This virus is still circulating. The B.1.1.7 variant is now the most common variant here in the United States. It's still out there. It's still spreading in the community, even here in the Wiregrass. So I do not recommend getting the illness. It is not a benign disease. I'm sure everyone in this room and everyone watching, listening, either knows somebody who's experienced COVID or knows somebody who died because of COVID. This illness is impacting all of us, and it's not to be taken lightly. For that reason, Southeast Health continues to strongly encourage people to get vaccines. To that end, we are trying to make registration easier. We have personnel available at various times in Piggly Wigglies. We are reaching out to local churches to register and enroll people. And beginning next week on Monday, you can get a vaccine at Southeast Health without pre-registering. No appointments will be necessary, and you can roll up and get your vaccine, and we'll register you there at that time. I really don't have any other comments at this time, and I'll be available for questions later on. Thank you.
Good morning, everybody. Thank you, Mayor and Commissioner Chairman Culver, and for the group for getting together today. Thank Mark Stewart for kind of coordinating our efforts from Southeast. Thank him for doing that. Also want to thank, again, Southeast Health for being the primary vaccination site for our region. Certainly Corey and I, our hats off to them. They've done a tremendous job of doing that. I will echo what Dr. Narby said. As he stated, there are only two ways out of this, and that's either have a vaccine or get the disease. I would not recommend that either. You just don't know what you're going to come up with if you do come down with the virus. So we strongly encourage vaccines at Flowers Hospital too. As of today, we have 16 in-house at our facility. That's 10 on the med-surg floor and 6 in the unit. That's down from a peak of 65 back in January, along the same time frame that Southeast was at 117. We certainly do not want to see that continue to go back up. Our lowest number during the past few weeks has been down to 6. So as you can see, even in a week and a half, 10 days or so, we've seen an increase come back up for our number of admissions into the hospital. We have had 2,800 vaccines given. Again, Southeast uses the Pfizer product. We use the Moderna product. And we were not identified as a mass vaccination site, so we feel pretty good about being able to do that many, that we've done 2,800 thus far. We also chose to go down the pathway of utilizing the monoclonal antibody therapy for people who were in the early stages of the coronavirus. We've given over 800 doses of that thus far since December the 3rd of last year. We feel like that's really been very helpful in keeping people having lower acuity with the disease process. We feel like that if we potentially had not done that, our peaks at both of our hospitals and the hospitals in the region could have been significantly higher. So we're grateful to have had that opportunity to do that. Currently, visitation guidelines at Flowers, these are going to break them down into kind of three areas. If it's a patient coming to the ER or outpatient area, it's one patient, one visitor or caregiver per patient. Pediatric patients 17 years and younger are allowed 2 visitors or caregivers. Non-COVID patient visitors will be provided personal protective equipment when they come in. Of course, it's obvious that we would do that for any COVID positive patients or anyone under investigation. For our non-ICU areas, non-COVID med-surg patients can have 2 caregivers per day. Certainly, again, I think that coincides with Southeast. Non-COVID patients also can be sure that we will be sure visitors that we will give them PPE if they so need it. ICU visitation is every day from 3 to 5 p.m. Visitation for non-COVID patients in the ICU is up to 2 visitors during that designated time period. We again just felt like this was time to be able to kind of move back to some sense of normalcy there, and started that about 6 weeks ago. And then visitation for COVID positive patients in the ICU, they may have up to 2 visitors during that designated time period. And of course, we don't enter the room. We basically allow them to see their loved one through the glass and have communication capability that way. Of course, we also would protect those people from any exposure to COVID-19. Again, I think we have all strived to be compliant with recommendations from CDC, ADPH, and other, governmental officials, and I think we've all done a really good job of trying to lead by example. We certainly are at our facility too. If you're inside the facility as an employee, staff, you're wearing a mask. We do not see that changing in the foreseeable future either. We also believe that it's important that we continue to practice those things that we've done throughout this pandemic. Make good choices about where you go, about who you are around for extended periods of time. We're still having virtual meetings. We have very few in-person meetings still. Hopefully we can get back to that one day in the near future, but we certainly will want to encourage everyone to continue to practice safe practices as it relates to the pandemic, because as Dr. Narby said, we're in a good place right now, but we don't want to see any kind of decline in the positivity that we've seen moving forward thus far. Again, I'll be around for questions, and thank you very much for allowing us to be here today.
Good morning. Thank you again, Mayor and Mark and everybody, for helping set this up and inviting us. We appreciate the opportunity to come and speak this morning. We also are seeing a steady rate, I guess, in our vaccine clinics. We saw a little bit of dip through the spring break time frame, but we still have appointments available, and we've seen a little bit of an uptick in the last week or so in our counties. Recently, we just, I should say, by the end of today's clinics, we should reach just over 32,000 doses that we've given across the 10 counties that I'm responsible for. So very happy with the work that they've done and the partners that we've had, Southeast Health and Flowers, and numerous other hospitals in my district, urgent cares. The federal vaccine program has been very helpful, I think, as well, with Walgreens and CVS and now Winn-Dixie's come on. So we've worked hard to make vaccine available, and we're still continuing to work on that daily. So thank you again for all those that have helped get vaccine out to the masses. So where do we go from here? We've had a change in the order. I would say that we proceed with caution, but we continue to wear masks, even if we're fully vaccinated. Dr. Harris has said that our health departments, our employees will still continue to wear masks. Our visitors are going to continue to wear masks for the foreseeable future. We also are using technology as effectively as we can, having a lot of meetings through Zoom, WebEx, and several other platforms that we can use to do that safely. and we'll continue to do that for as long as it's needed. There's no way to replace a face-to-face meeting, but I think, for now, this is the most prudent thing to do especially with travel and everything that's considered in that. So, like I said, we were going to continue to wear masks even though fully vaccinated. I would encourage people that even if you've had one dose, especially that time between your first and second dose, and even that 2 weeks after your second dose, before you're considered fully vaccinated, be sure that you wear your mask. Around unvaccinated or partially vaccinated persons, we encourage everyone, of course, to wear their mask, and that includes family members. Until we know more about the long-term effectiveness of the vaccine, we encourage people, of course, to continue to wearing their mask. Continue to use the other tools as well. The hand washing, the sanitizing, the distancing, all those things play together, even if you're fully vaccinated or in the process of getting vaccinated, to help keep everyone safe. It keeps family members, coworkers, helps keep our schools open, those kind of things. So remember those as all tools. We have a wonderful tool with both the Pfizer and the Moderna vaccine, and the J&J that has come on recently. But we want to make sure that we use all those together to get the most effectiveness. Thirdly, I would say encourage others to use those same tools. If you're doing them, we certainly have tried our best to make good examples for everyone that comes into our buildings. And just personally, when we're out shopping and doing those things, we've encouraged our employees to do those things. Encourage others to get vaccinated. This is very important. We have seen some decline across the state in certain places, but we have made a lot of gains recently. Most counties throughout the state have over 20% of the population that have received at least one dose. 4 of my counties are now over 30% of the population that's received at least one dose. But we want to encourage anyone who has not started the vaccination process to go ahead and do that. It's probably one of the number one tool right now in those tools to help keep people safe, to keep yourself safe, and also then to protect your family, your coworkers, those kind of things. So going forward, we just encourage people to continue to wearing the mask. We encourage businesses to encourage the use of it where it's practical. As we learn more about the effectiveness of the vaccine, and more, as we see more Alabamians get vaccinated, of course, we'll make updates to those recommendations. But we're going to continue to follow CDC guidance and Dr. Harris's guidance for the state, and I would encourage others to do so, at least until we get further down the road with our vaccination efforts. If you're wondering where to find vaccine or who has a certain vaccine, there's a very helpful website that was updated recently called Vaccinefinder.org, and you can get everything from the grocery store sites to the Walgreens to our county health departments are all entered in that now. It actually tells you what vaccine they have available, and it has links to those individual organizations where you can make an appointment. So it's a very helpful tool, and just encourage people to use that tool if you're looking for vaccine. So thank you again, and I'll be available as well.
Can I take my mask off now?
Yes, sir.
Thank you. We want to thank all of the folks that spoke before us that know what they're talking about. We're here representing the public sector just to follow up and tell you these folks know what they're talking about. And we want to encourage all of our citizens in the city and county to continue to be cautious. We all have hopefully gone and gotten the vaccine, or as many of us as we can, obviously not all of us, but we want to continue to encourage everyone to get the vaccine. We have partnered with the health department and are working on a vehicle to try to get the vaccine out to those who may not be able to get into town, so that the vaccine can be given to as many people as possible. We changed our procedures at county facilities as of yesterday that in line with the governor's order. Masking is not mandatory anymore, but we highly recommend and ask you to please wear a mask when you come in. We are still social distancing. And we, frankly, we encourage businesses to use that same, if not stronger, order in their businesses. We are not, as you have heard the health professionals say, we're not over this. There is a new variant. There are places where The cases are rising again, including the state just to the south of us. So we want to continue to be very cautious. I know we're all tired of this. I hear it all the time. I'm so over it. Well, we're all over it, but at the same time, we don't want our loved ones to again be sick or get sick that haven't been, because it continues to be a very, very contagious virus, and in some cases deadly. So please, please continue to do the right thing, continue to mask, continue to social distance, just continue to do the right thing for your community and for your fellow man and your family. And that's our message from the county and from the city. We believe what these experts in the medical field say, much more than we believe some of the things you can read out on social media. These people know what they're talking about. They deal with it every day, and we continue to commend our health officials and health providers that see this every day. So, Mayor, with that, I'll let you close us and answer all the questions these people have.
Cautious optimism. Two great words, and I'm not going to talk about any of the tough stuff that we've been through and focus on the fact that we are in a better place. And I want to say a lot of thank yous because they deserve it. We are blessed to be in the community that we are in. From a medical perspective, we have great hospitals and doctors and nurses and staff and all of those that have contributed to it and getting us through, and as we continue to go through this pandemic. I want to say thanks as well to Southeast Health for the mass vaccination site that they have done, and they've done it extremely well, enough to even garner statewide attention. And so we are grateful for that. And Flowers Hospital, Jeff, done an excellent job with all that y'all have done as well. ADPH, Corey Kirkland, has had an extremely challenging role in all of this, and Chairman and I are grateful for all that you've done. One group that's wasn't able to be here because of a meeting was the EMA, and they have been a great asset as well in all the efforts. So once again, I think one of the things that I think is important is the fact that when this city and county in this Wiregrass area encounters trouble, we come together well, and we do a great job, much better together than we do apart. And I'm thankful for that, Chairman Culver and all of his efforts, and continuing to do that as well with the city. Just to add a couple of city things. One is that after a lot of discussion, the city manager has also recommended here in the facilities that are owned by the city, we'll continue to wear masks for a while longer until we feel that it's safe for not only our employees, but those that are coming in to see us as well. We will continue along that line. We do encourage vaccinations. One of the things that we think our role is to educate people and inform. So to that effort, we, Vincent and our Community Relations Development Officer in the department there, we are putting out some billboards that we will see. It's called vaccinatedothan.com, and it will lead you to a website that will answer those myths and lead you to the facts behind vaccinations as well. Again, misinformation has been an enemy of, I think, all of us during this time, and we encourage you to go to that website and before you make your personal decision to get a vaccine or not. So we do encourage it, and I've had mine. So we are going to open up now for questions in media. If you will, just direct your question to whoever it is that you would like to answer it, and then we'll all come up here and answer that. So open it up for questions, or if none, and you wanted to get each person individually, we can do that after we adjourn. So, yes.
Mayor, this is either for you or Chairman Culver. If we end up going into another wave like Dr. Narvi had explained, could we see something with the city in particular or the county that might take like a safer at-home order like we saw with the governor, but it would just be for Houston County, or a mask mandate, or anything to that effect if we see the numbers start to rise again?
You want to start?
You can.
Okay.
Mine's real easy.
Okay. Since the beginning, I think Chairman Culver and I have shared the same opinion. That is, whatever the ADPH and Governor Ivey and Dr. Harris recommends for the entire state, that's what this city, I believe this city and county would probably would continue to do as well as we are, even as to this day. Yes.
Mayor, you did mention that a website would be started to help debunk some myths that are out there about the vaccination. Can you just briefly tell us, because I know some people are still concerned about getting vaccinated, so can you tell us a little bit what we might see on that website?
Sure. So the billboards are aimed at, they will start off, you'll see something like myth, and state one of the myths. We have about 5 representations of myths that are out there about vaccinations. And then because you don't have enough room on the billboard to answer it there, we're going to funnel them to a website. It's vaccinatedothan.com. And you go to that website, which actually is the CDC's myths and facts debunking website and page. And if I were going to give someone in my family a website to go to say, here's all the questions that you may have about vaccinations, and here's your answers, this is the one that we would send you to and that I would send you to.
Yeah, and I would just say, you've got 2 examples right here of 2 people, and probably others, but 2 that you know that have had both rounds of vaccinations, and neither of us have any strange things that have happened. We both, I think, feel much more comfortable having had the vaccines, but we're still cautious. We want that to be the attitude people have. Get the vaccine so that you and the people surrounding you are protected, but maintain your cautious attitude. Keep your mask, keep your distance. The vaccines obviously are safe. We don't look any worse than we did before we got them. So, with what we had to work with, yes.
This is just for whoever would like to answer. Is there a COVID case number that you would like to see before lifting your mask mandates? Or does it pertain more towards vaccine numbers?
They both stand up. Let him.
Well, of course, the number we would prefer to see, of course, is 0. I think, from this public health standpoint, we're looking at the entire state. But certainly, we would see that there might be some areas of the state that get to a point that's a little bit better than others, a little bit quicker. That may have something to do with population. It may have to do with uptake in vaccine, or all of those above. I think recommendations from us would probably be a statewide recommendation, and then each county and city needs to kind of look at their own position and where they are with vaccinations and with cases and those kind of things, and make their own determination. But, if it's like they said, there's really 2 ways out of it. We all get sick or we get vaccines. I'm like them. I would suggest that you get vaccine. It's a much simpler, it's a much better, I think a much more effective way of protecting us all, and so that we can finally, let this down, and that we can enjoy all those things that we want to do, and we remember doing a little over a year ago without all this. I've had the vaccine as well. My family has. My mother and father have. And I would suggest, just like I did a few months ago today, that anyone who has not had it needs to get it. It is effective and it's safe. So of course, we'll have more recommendations as the state gets more people vaccinated.
Corey, I have a question for you. So the CDC, for lack of a better word, recalled the Johnson & Johnson vaccination in the last 24 hours. How do you think that's going to affect the number of people vaccinated, whether in Dothan and Houston County, in the 10 counties that you oversee? I know a lot of smaller areas were able to get the Johnson & Johnson 1 shot because it is 1 shot, and it didn't take extra precautions to store. So do you think that we'll see an impact on the numbers of people getting vaccinated because of that recall?
I would say it's possible, but I certainly hope not. For the last few weeks, I've been telling people, even though the one shot or the one dose shot was coming, if you had access to Pfizer or Moderna, please don't wait. Go ahead and get it. Yes, it's 21 days or it's 28 days. Yes, you may have some side effects that are short-term from it, but they both prove very effective in keeping people out of the hospital and preventing death. Johnson & Johnson has proven that too. But the supply was very low. I know Dr. Harris is addressing some issues with Johnson & Johnson this morning, I believe at 11 o'clock, so I'm sure he'll give you some more insight on that. But I certainly would encourage anyone who's been waiting on it not to do that. Go ahead and get the vaccine that is available. Our health departments, our hospitals, any of our federal pharmacy partners that have it, go ahead and do it. I wouldn't let that stop me, and I'm not going to let it stop me encouraging people to get vaccinated.
Just a quick follow-up to that, what would you say to people who might be a little worried after seeing that happen with the Johnson & Johnson vaccine?
Use a trusted source for information. Like they said, the CDC is great, but you can also go to the manufacturer's website to learn how the vaccine is made, to learn about the ingredients. Ask your private physician, ask your personal physicians what they think about the vaccine and why they think you should get it. Do your homework. I certainly understand the anxiety. This past year has been full of anxiety about this virus, but we've also had a lot of deaths and we've had a lot of sickness that we can now prevent, I think. So do your homework, but use trusted sources when you do that, and I think people can come to a good conclusion.
I would just like to make a quick comment about your question. The vaccine was not recalled. The FDA put a pause on using the vaccine. From what I understand in reading about this story broke just this morning, it was 6 patients out of almost 7 million vaccinations. So the CDC is using a very much, or FDA is looking at this in a very cautious way, and I don't think that necessarily means that, we'll see, and Dr. Harris will speak to that later today, about the long-term impact of this pause today.
Any other questions? All right, well, once again, thank you for being here, especially media, for helping us to broadcast the information today, and appreciate all the partners that have been. I saw Chief Williams from the fire department come in a minute ago, and there he is. They have been a big part of this as well, and once again, I thank Chairman Culver and the county and our participation with them. So, thank you.